I have thumb arthritis and I don't know what to do. Hoang, help me. My name is Hoang. I'm an occupational therapist and certified hand therapist. And if you have a thumb arthritis right here at the base of your thumb, stay tuned. I'm going to share with you tips, but more than the tips that I can share with you, I really want to encourage you to make some decisions around what you can do about this thumb pain that you have or thumb arthritis that you have, because it doesn't have to get so bad that you need to have surgery for it. Because this is what happens. People get thumb pain. Women tend to get thumb pain more than men do, especially at the base. It starts on one thumb and then it can start to get worse on the other one. It usually happens to women in their peri or menopause phases of their life. I recently just had someone who came in with bilateral, meaning both thumbs, thumb pain, and she says she has the arthritis there, and it's causing her to have trouble carrying her suitcase and putting it up on the luggage, being able to do yoga and being able to put her palms fully flat on it. And the doctor was just like, well, you know, we can do injections, and then if it gets worse, we can have surgery. So there's definitely a lot of techniques from a surgery standpoint that they do really great work if you decide to go that route. But I'm here to help you if you're trying to avoid having surgery and trying to avoid having a thumb replacement. That's what they call them, a CMC arthroplasty. That just means they replace the joints right there. But there's a lot of things that you can do ahead of time to ensure that your thumbs stay healthy. As a hand therapist, I use my thumbs for just about everything. Well, we all do. The thumb does 50% of the work of your hand, and without them, you really can't do that much, because between your thumb and these two fingers, it gets you to pick up little things, do your buttons and stuff like that. And then these two fingers, your small finger and your ring finger with your thumb, they're the powerhouse. They're what gives you power. So imagine your thumb does 50% of the work of your hand, and if your thumbs hurt, then you feel like, oh my God, I can't really do anything. What happens in our thumbs is over a period of time, these are what we call our thenar muscles, right? These are our thenar muscles. It just means that we have a bunch of little thumb muscles. And then we have one big thumb muscle. It actually starts down in your forearm. It crosses your wrist, and then it does a turn up here. And then it ends right here. So this big one helps us to bend the tip, but every joint it crosses, it bends as well. And then we have these thumb muscles. And if your thumb is doing all the work all the time, you can end up with thumb pain right here at the base. And most people will start to think, oh, if I have pain right here, I have thumb arthritis. Find you a trusted occupational therapist or certified hand therapist to help you determine, do I really have thumb arthritis there, or do I have some muscle imbalances causing me to have thumb pain right here? Specifically, if you have some arthritis here, you might start seeing some swelling right here that looks like a big old ball. And we call that, in the hand therapy world, we call that shouldering. So basically, it's like the shoulder of the thumb. And we call it shouldering because this bone gets really big. And it gets really big because this bone right here, this is your thumb bone, it starts to fall into your palm. And as it falls into your palm, this bone tends to stick out quite a bit. And so hence that very typical arthritis type of pain that you have here. And what happens is if you're there and you feel weak and you're just constantly squeezing a ball, guess what? You're making it worse. So let me share with you what you can do to help make it better. If your thumb is falling into your palm, we actually want to help it move into the opposite direction. This is actually a little bit more technical, so I just want to show you, but again, it might behoove you to find someone who knows how to do this. But you want to grab the base of it and you want to shove it back, right? Don't shove it straight back. You're gonna shove it back and out to the side. I actually teach this technique inside my manual therapy class that I teach with my therapist. So I wanted to share it with you because it can be really, really helpful to just ease off the pain. So you put your fingers and your thumbs together like this, kind of like a crisscross, right? And then you want to relax the hand that you're stretching. You have to be gentle. If you're aggressive, you can actually hurt yourself. So I want you to be gentle, and if it hurts you, stop, all right? So you're gonna use your thumb, flat of your thumb. You see this crease right here? You wanna pull it out. Use your thumb, pull it out. Pull it out and back. That's it. That's the stretch. Pull it back and out. It's a little bit more technical. Hopefully you can try it yourself. You wanna lock your elbow down on the table when you do it, or what I do is I shove my elbow into my side when I do my own thumbs, right? I shove my elbow into my side and then I just shove it back, right? Shove it out and shove it back. And it's a really great stretch for your thumbs to kind of ease off that pain. People have thumb arthritis pain because this bone here starts to fall in because these muscles are too, how do you call it? It's not too strong. It's just one, gravity, but two, you're using it all the time. We always use our thumb pulling it down. So over a period of time, it just starts to fall and get real tight. So these muscles here get real tight and they start to pull that even further. If you have thumb pain in one hand, most likely you're gonna end up with thumb pain in the other hand, which is why it's so important to find a trusted occupational therapist or certified hand therapist who can help you, get you out of pain and then show you once you're out of pain what to do. Because if you're working on one thumb, your other thumb is gonna hurt and then you're just kind of going back and forth, right? That's one stretch that I like to do. The other one, I like to use a wall or a table to help me. So let's do it on the table right now. Same idea, but now we're gonna use the table instead of our hands so much. So you can put your fingers underneath, you can wrap it around. See, these are your thenar muscles. You see this crease right here? You can put your fingers there, you're gonna wrap it around. Be gentle, be light. Just kind of pull it to you. Your thumb is gonna be on the other side. Pull it to you. So you're gonna roll it out, right? And then you can use the flatness of the table to just pull it out and up. So you're pulling out and you're pulling it up. Pull it out and up. And then you can stretch it out a little bit right here. That's it. Those are two gentle stretches. Magic word, gentle. Every time I practice this with people, they're very aggressive. They're like, let me do it hard this one time. No, it takes time, especially if you are shouldering, right? Especially if your thumb has fallen quite a bit into your palm. You just want to be nice and easy and gentle. And then the exercise to really help promote it to pull up is with a rubber band. Let me grab one. I have a few rubber bands in my clinic of different sizes, different like intensities, right? And then I just put it around my fingers and around the thumb, and then I open. All right, and just open. So instead of constantly making a fist, let's open your thumbs, let's open your fingers up. And it's one of the ways that I work with to ensure that the thumb doesn't keep falling down into the hand and cause more and more of the arthritis pain that you have. So over a period of time, people's bones don't sit where it's supposed to sit, right? It starts falling and falling, and then as you move it just rubs the wrong way. And so over time it causes more and more of this thumb arthritis. If we can catch it and we can put it back where it's supposed to belong, and we help all the muscles around it help this joint move better, you can actually protect your thumbs for the longevity and the life of your hand so that you can be more independent, live pain-free. And there's a lot more that goes into helping thumbs be more pain-free. This is one example of what you can do. If this video helped you, like it and share it with someone else, because I know you know somebody else who has thumb pain just like you. My name is Hoang. I'm an occupational therapist and certified hand therapist here in Miami, Florida. If you need my help, all my links are below. I'll see you in the next video. Thanks for watching.